I'm Jay Moran.
I'm Bridget Jaipal Valenza.
I'm Thomas O'Neill White.
I'm Angela Preston.
We need to get together and let our voices be heard.
This is What's Next, a dedicated hour to have important conversations about the issues facing the marginalized and underrepresented communities of Western New York and Southern Ontario.
If we're going to have some real healing, we've got to have space to tell some uncomfortable truth.
What's Next continues our mission to discuss race,
Equity,
And the common concerns of Buffalo's East Side and beyond.
In the suburban area, everywhere, we must work and teach our children.
This is What's Next. I'm Thomas O'Neill White, and joining me today to talk about the harmful effects of menthol tobacco on the Black community is Roswell Park Comprehensive Cancer Center Director for Training, Development, and Support in the Cessation Services, Sarah Pearson-Collins, and Stan Martin, the founder and director of Stan Martin Consulting and the former director of CAI's Tobacco Control Project. Thank you both for being with us today.
Thank you for
Thank
having
you.
us.
Thank you.
Yeah.
Tobacco use, specifically menthol cigarette use, has been ingrained in the Black community. We know that menthol is more addictive than non-menthol cigarettes in some cases. What is the history behind menthol products being sold and pushed in the Black community? Stan?
Yes, no, thank you for having us this morning. It's a pleasure to be here. You know, when we look at historically the appropriation or misappropriation, how you want to frame it in regards to menthol tobacco, at the root of your question is the African Americanization of menthol tobacco in the Black community. One of my mentors and colleagues, Dr. Gardner, he liked to frame it as this in terms of in the early 50s, less than 10% of African Americans or those who identify with the Black diaspora smoked menthol tobacco. And then fast forward, or even in between there, today, 85% of African Americans who smoke menthol tobacco. And the reason being, over that period of time, there was free marketing, or I should say free giveaways, the Lucy cigarettes, the sponsorship of different festivals, concerts. I'm dating myself a little bit when you think about the Cool Jazz Festival for some of our listeners. That was about menthol. So that was about really, really trying to mask a business and organization that produces a product when used as intended, kills people. And, it was successful.
I think if we're looking historically, it can be traced. So tobacco itself can be traced all the way back to slavery, a crop. It was a crop. Mm-hmm. And so, when you think about your ancestors, how they grew it, they picked it, they smoked it, because it was the access to it. And so I think it starts, further back than just, of course, in the 1950s, there's this big promotion for the menthol piece of it, but even just tobacco itself being traced all the way back, into the 16, 17, 1800s.
Absolutely.
And Sarah, you've got your own family history with tobacco.
I do.
And you wrote a really powerful op-ed in the Buffalo News. Do you mind sharing?
Yeah, so I think that I've watched my family smoke for years. I don't even know how I even got here, being a tobacco advocate, but I'm thinking back as far as being a child and attending family functions and, having a great time, in the kitchen would be coffee and cigarettes. And they're just smoking one after the other. And you watch it, but you don't really pay attention. And some of the younger kids would go and steal cigarettes and they'd go back, in the back and smoke. And so this was like part of the family dynamics culture. That's how they communicated. That's how they socialized. And it wasn't until later in the, 1990s that you actually started seeing the harm that came from the cigarettes, with, a lot of my family members getting sick and then dying ultimately from tobacco-related diseases.
Now, was that what kept you from smoking? Just the understanding that this is going to cause this, and this?
I don't think I even paid attention to the the fact that it was causing you to become sick. It was just so okay. When I was younger, like the smoke itself was so irritating towards me. Like I have allergies, so I couldn't be in this space with them for long periods of time. You would sleep at certain houses where I went to the houses that didn't have the smoke because it would really affect me physically. So
And that smell.
I just
clings to
stayed away.
everything.
I don't like the smell of it. And just, my eyes would be running and coughing and hacking. And so I kind of stayed away from it. And I guess that was a deterrent. My parents didn't smoke either. So it wasn't something that was condoned or even, an access to it in our household. So, I think everybody tries it when they get into college for 2 seconds. For 2 seconds, and then they say, "This is
the peer
dumb."
pressure is real, right? And Sarah, thank you for sharing your story. And I think one of the things I would really also like to highlight is that what Sarah was also speaking to was the normalization of tobacco use in the Black community, and how it was heavily marketed, how it was advertised. Whether, remember in our households, you could be sitting around, or in the living room, you might see, Ebony or Life or Jet magazine, and the amount of advertising, tobacco advertising that was in magazines at that point in time. Or if you're, traveling through the community, going to the grocery store or to and from school, the enormous amount of tobacco advertising on billboards to and from school or to the grocery store. So, seeing those slogans, alive with pleasure, or showing or promoting a lifestyle that people aspire to be and to live. And, the tobacco industry capitalizing on that and say, this is a way that we can infiltrate, the Black community. This is a way that we can promote, our poison, our product, to normalize its use. And that's a part of the whole strategy as well.
And it's specifically menthol cigarettes. Because you can, and I remember this, reading a Jet, reading Ebony, and seeing those cool those type of menthol cigarettes, as opposed to, reading like a Sports Illustrated or something that's like Marlboro or Camel or something like that.
Absolutely.
Really, really interesting to look back on that. Stan, can you tell us about the work you've done, both with CAI, which you no longer work for, and also outside of CAI?
Absolutely. I've been very fortunate to work with tremendous individuals such as Sarah, who's here with us today, as well as other organizations locally, Roswell Park Cancer Institute, Pastor Nicholas at Buffalo Center Health Equity, as well as others here in this community who are champions, ambassadors to really protecting the life and well-being of others. And on the national level, the African American Tobacco Control Leadership Council out of California, and the Center of Black Health and Equity. And I would say I share that because this is an effort that's happening nationally and locally, and we're all saying the same thing, and that is Black Lives Matter. Saving Black lives, is important, and preventing the next generation of youth from becoming replacement smokers is critical, to our history, to our country, to our future. And we cannot address, we cannot say that health equity matters if we don't address menthol tobacco, if we don't remove menthol from the shelves. As you mentioned earlier, menthol was created specifically, to help the poison, as some of us like to say, go down smoother.
Right.
Easier. You inhale, you digest it deeper, in your lungs, in your body. So, it helps to mask that harshness. It helps to mask, some of the other, carcinogens and poisons that come along, with, smoking tobacco. And let's be real clear. We're talking about commercial tobacco, combustible tobacco, not traditional tobacco. So I really want to, make that, that clear in terms of our subject matter today.
And the thought was, before all this research and these studies came out, that menthol cigarettes were somehow healthier because when you inhaled, it wasn't as harsh.
Correct. Right.
And then you can see even the advertisement or the marketing practices. If you think about the advertisements in the 60s and 70s, you have doctors, and they're saying, it's a win-win, because it's also helps, it gives you a cool, fresh, perspective when you're smoking it, and it's more palatable. So, if you have a doctor that's advertising, in a magazine, so you're thinking, of course, it's going to be healthier.
Right. And one of the other, I would say, populations, I know we've been focusing primarily on the African American population, specifically to this point. The tobacco industry, they're snakes. I'm just gonna call it. Okay, a snake is a snake. And in terms of their marketing and advertising, they've also, targeted the LGBTQIA population, Hispanic population, other, populations, marginalized populations, specifically, for profit. So when you look at their history, I think it's very telling. Even women, even like children, as I mentioned earlier, from targeting or replacing those that Sarah spoke to that can no longer smoke.
I'd be remiss if I didn't give a shout out to Pastor George, who you mentioned earlier. Great guy, doing a lot for the community as a whole in Buffalo and Western New York. What are the tolls on a person and to the large community that tobacco use takes?
I think when you, and Sarah, please, I know you can speak to this eloquently as well. When you look at tobacco, let's just say African American population, over 85% of African Americans who smoke menthol tobacco. Okay, when you look at annually, that means that 45,000 African Americans die each year as a result of menthol tobacco use. Tobacco use affects every part of your body, every organ of your body. So you talk about cancer. When you look at cancer, you look at lung cancer. When you look at stroke, when you look at diabetes, or when you look at other chronic illnesses, respiratory illnesses, etc., it impacts every part of one's body.
Inflammation diseases, it affects your eyes, your teeth. So, some people don't think, oh, well, I didn't have cancer, but they may have issues pertaining to teeth. There's tumors that grow, and I'm just thinking about even just from my family's perspective. So, no, they did not get cancer, but then they may have had like rheumatoid arthritis, which is inflammation disorders, fertility issues. So there's a lot of different things, and people just think, oh, it's just the cancer, but there's a lot of health factors or health risks solely based on smoking.
Right. And when you look at the totality, even though in terms of let's say African Americans, we may start smoking at a later age or smoke less, we die more as a result of those exacerbated health conditions. So this is an issue. This is a serious health issue, a public health crisis, and we're once again we want to raise awareness. We want to educate. We want to help people to make a informed decision, and at the same time, we want to make sure that we holding those accountable, responsible, for the death and disease that's totally preventable.
But to play devil's advocate.
The devil don't need no help. But go ahead, Doc.
To play devil's advocate for a quick minute, some folks would say, why not just let people enjoy what they want to enjoy? If they're consenting adults, just let them have their smoke, basically.
Yeah, I mean, I think one of the things I would like to say is that we're not against, people, or I'm not against those who smoke or utilize tobacco. We are against, the tobacco industry intentionally targeting and marketing a deadly product. When used as intended, will kill you, will kill people. So when you're talking about menthol in particular, there's tremendous health disparities in terms of 85% of African Americans I mentioned earlier who smoke menthol. Well, less than 30% of whites or those non-African Americans smoke menthol tobacco. So there's a huge disparity there. So if we if we can assist those who are trying to quit and to reduce those health disparities to lessen them, then why wouldn't we? So we have a moral responsibility, to really provide a environment where everyone thrives, where our children can live a long life, and go ahead, Sarah.
No, I was just thinking, when you asked that question, so, when you poll people who want to quit, 70% of people actually want to quit. There's only 30% that's actually ready to quit. So there's a very big, group or percentage of people who really do want to quit. It's not like, oh, we're just, we just like to do this. People don't, the cost is, going up every day.
Right.
They're noticing health effects from the smoking. It not only affects the person who's smoking, but it affects everyone around them, because if you have children, you've got the second and third hand smoke. You have the caregivers who will be responsible for these people once they get to a place where they can't take care of themselves. So it's not just my own decision that I want to smoke, but everyone is affected around them, when they make this decision.
Right. And, like going back once again, when you look at its impact on tobacco, Sarah mentioned how the vast majority of people who smoke, a large proportion, do want to quit. And we do know that, for example, we do that for those, if menthol, let's say menthol was banned today, all right, or over 250,000 African Americans' lives will be saved as a result of a ban on menthol tobacco. So this has huge implications in terms of saving lives, providing a safer, healthier environment, for our children, for the next generation, and addressing the health inequities that exist and disparities as a result.
You're listening to What's Next. We are talking menthol cigarette smoking and banning menthol cigarette smoking with Sarah Pearson-Collins and Stan Martin. What are the next steps then to ban menthol cigarettes locally and nationally? I know recently there was a menthol funeral in January in Washington, D.C. Stan, you were supposed to go, but due to the
living in Western New York,
due to the litany of winter storms we had in January, you were unable to go. But can you talk about the event?
Yes, absolutely. Thank you. The menthol ban funeral in Washington, D.C. was actually championed by the African American Tobacco Control Leadership Council, as well as a host of other advocates from across the country, where individuals, organizations such as myself from California to Washington to Atlanta and Wisconsin and far beyond, really held a menthol funeral in Lafayette Park, I believe, Lafayette Park down in Washington, and they really was to really call on the Biden administration to really fulfill its promise, and that their promise was that they to the African American people that they would make a decision to ban menthol tobacco by the end of this year. But however, that decision has been delayed, and that decision has deadly consequences, daily, on the Black community. I think one of the reasons why I know for sure that the reason that it was delayed was because some of the tobacco provocateurs, lobbyists, what have you, said that, or, their message was that it would cost Black votes. It would cost the administration, to lose support, for another term. And pretty much those messages, those key messages, was that it would create a illicit market, which a illicit market already exists for tobacco, as well as it would increase policing in the African American and the Black communities. Those are some key issues, and that they need to be addressed. However, the ban on menthol really it's not on criminalization. There's nothing in the ban about someone will be arrested for possession of menthol tobacco.
Right.
That's ludicrous, all right? Jedi mind trick, as we say. It places the onus on the manufacturer and on the retail sales of tobacco. So that is fear mongering, the gaslighting, scare tactics that has been utilized to not only with the administration but also with the community, with the public community at large. So what we've been trying to do, and we're going to continue to do, is to educate the community residents in regards to not just what the legislation is about, but also the impact of menthol tobacco. And in addition, to help those who want to quit to quit. So locally, what we've been doing here, fast forward, is to really look at meeting with our local councils, our councilmen, our elected officials, our government entities that really can put pen to paper, to move a ban on menthol forward. So, and that's at every level. So the local, city, the state, and county.
I think some people would argue that the Black community can't be any more policed, and so it's disheartening to hear that lobbyists would make the claim that more policing would occur in the Black community with the trying to eliminate menthol cigarettes. Is there a way to, you talk about putting pressure on local electeds. Now, can that go up the chain? Is that going to go up the chain? Local, city, state?
It's already happening.
It's already happening?
It's already happening. We we and several faith leaders from the city of Buffalo, we've actually already been on a conference call with the White House, with the Biden administration, alerting them, but sharing with them what's happening here at the local level. Since the menthol funeral, I believe that was on January 18th in D.C., since that time, myself and others, we've met with Senator Chuck Schumer. We've been in constant conversation with the Buffalo Common Council, who's developed a resolution at this point in time, and they're looking at, doing, taking some other steps moving forward based upon some of the information that we've, provided to them. And we believe that there is tremendous support at the city and potentially even the county level as well. So we're doing our due diligence, and I just want to really once again emphasize moving forward the importance of reaching out to our community, our grassroots organizations, to partner with them, to come alongside them, to really show that this is a part of a movement, a national and local movement, to save Black lives.
And then I guess from the clinical standpoint, with Roswell Park, when this ban takes place, what do we do with all of these people who smoke menthol and want to quit? So being able to develop content that is individualized to meet the needs of folks, who are smoking menthol, and be able to provide services for, helping them to stop smoking. Providing some type of counseling and support, or coaching and support, and being able to also give them the appropriate nicotine replacement therapies so that they would be effective with quitting. Because we know that with the menthol added to the nicotine really makes the quit rates more difficult. So, they have a lower quit rate, and and of course we know that there's also barriers and things in place that prevent them from quitting. But then just those two ingredients together really makes it more difficult with the quitting efforts.
On the ground level, when you speak with someone who is trying to quit, what are those conversations like, and what's kind of a strategy that you plan out for them?
So basically identifying, when we're taking them through an interview, we want to find out how much they're smoking. We want to know what their triggers are. We want to know, when and where do you smoke the most? So they give us a list of things. Well, I smoke in the car. I'm smoking, when I go on my breaks. And then ask them to, so then we're creating a list of things that why they may be smoking. Is it emotionally? Is it a physiological response? Or is it a situation? So we're looking at those situations, we're looking at those emotions, and we're doing a cognitive behavioral approach where we're, addressing those situations and, well, what can you do instead, that sort of thing. We know the physiological responses, the nicotine replacement therapy is going to be the most effective thing for that because that's what it addresses. But it does not address the issues like I'm smoking when I, get up in the mornings. So, it's almost like a problem solving, well, what can you do to start to prepare them for this quit date, so that they will be ready when these situations occur. Because, of course, it's, if you've started smoking, it's, you're addicted, but then it's also it's also become a habit.
Right.
So it's breaking habits. It's a behavioral change. So looking at, what we're doing and then breaking the chain and replacing it with something that's more healthier.
Right. Did you have something to add?
No, I was just going to say one of the things that we're going to be doing at SMC, Stan Martin Consulting, we're going to be launching piloting, I should say, a program called Free and Proud, which is a tobacco cessation program with Dr. Karen Beard out of California, who also works with the African American Tobacco Control Leadership Council to really look at menthol specifically and look at how, as Sarah described, like what are the challenges, but also what are the assets or other tools that might be necessary to help someone who want to quit to quit. Mm-hmm. So making it a little bit more culturally and linguistically appropriate for folks.
Addressing the issues that are commonly found or within those particular marginalized groups and being able to address them.
So it's very important. Like we want to really emphasize. So it's not like we don't understand or we're insensitive to that. This is a addiction. All right, and not everyone can quit cold turkey. Some people
only 4%.
need. Wow, you see what I'm saying?
Only 4% can quit cold turkey.
So a lot of people need more resources. So and we want to be that pathway. We want to create that access, to those services, to help those, who are, struggling, who need that extra support.
And everyone understands that smoking is not good for you, but how does the education go farther?
Mm-hmm. Well. Can I chime in on that?
Oh, go ahead.
Sure, thank you. And please. I would say that, really, and this is why I love the work that we're doing in concert with the Buffalo Center Health for Equity, Pastor Nicholas. We're really looking at the social determinants of health. Mm-hmm. We're looking at, where you live, where you work, where you play, where you learn, even where you pray, how that impact, your health outcomes. So it's not necessarily siloed. There's different points of intersect that really come into play, that we have to have a comprehensive approach. We have to look at, the burden of tobacco in terms of health, in terms of financially, on our community, and really work together to address those issues. So that's why when I mentioned earlier, the political environment. So the social as well as the political environment, determinants of health, have to work in concert with one another in order to be effective. You can't expect, individual change to take place if the environment doesn't change as well. So, in my opinion, in my experience, that both of them have to work in concert with one another.
Yeah, it's a psychosocial behavioral approach. So you're looking at it holistically, and you're, when you're treating an individual, you want to make sure that all those components are addressed in order to be able to effectively treat them and get them to quit, So it's not just the one thing, give them a nicotine replacement therapy, that sort of thing, or put a patch on them, let them go. No, we know that using a patch and being able to do some type of counseling or coaching doubles the chances of quitting. So, being able to look at all of the barriers, like we mentioned before, to address those during those sessions, to be able to get them to, quit effectively.
Yeah.
So
we've got a few more minutes left, and I've got just two more questions. One is about smoking trends. Are they on the decline? How does vaping fit into the whole smoking cessation equation?
Well, I'll start us off. I would say that, smoking definitely overall, when you look at the prevalence of smoking rates, are some of the lowest that they've ever been amongst adults and youth, and in particular here in New York State. However, when you look at some of the strata data, when you break that down in terms of who is smoking, We know that education attainment is important. With those with less than a high school degree or what have you, or you look at economics, in terms of those who are living at or below the federal poverty level, or less than $25,000 a year, smoke at higher rates than the general population. When you look at mental health, tobacco use kills over 480,000 people annually. However, when you break that down in terms of who's smoking, almost 40%, I believe, the data shows that have some type of mental health, impact or connection. So even though my point is this, even though, we've done a tremendous job with the general population in terms of reducing the prevalence of tobacco use, there's still a lot of work to be done, and in the African American community and in some of those other sectors, points of intersect that I mentioned. And then, vaping itself, is harmful as well. Might be less harmful, but still, there's a cost that has to be paid, as a result of that.
So I guess I have a few thoughts, and the first thing is that, so we talk about policing earlier, and what's not policed are the corner stores. If I go out into the suburbs and go to a corner store, if there's one, I'm not going to be able to get a Lucy.
Right.
So when we think about even smoking and in the poor neighborhoods, like the smoking hasn't really gone down because I can go to the corner store and get a couple cigarettes that's going to help, that's going to get me through, and I'm still smoking, So I feel like there needs to be more policing, in the communities, That's just one thought.
Yeah.
I mean, vaping, of course, the tobacco companies have made it so that it's alluring for adolescents. All those flavors, over 6,000 flavors and counting, and it doesn't look harmful. It's just some smoke and it tastes like strawberry.
Right.
So they appeal it to the children, and so they smoke it thinking that there's no nicotine in it, until there's a something that happens in the media, and then they realize they can't stop. Now they need help, and they're calling us for assistance. But it's marketed in a way that it seems like it's harmless, when here we go again. It's just a different form.
And we have to ask ourselves the question. I mean, I believe in it was 2009 that all flavoring, in terms of tobacco products or e-cigarettes, were removed except for menthol. Why? Why? I think we all know that answer. All right. However, now is the time that we can no longer wait. It's been over 12, 14 years since, this has been an issue, and we can no longer kick the can down the street, down the road, or whatever. Now is the time to say that, Black Lives Matter, saving Black Lives Matter, preventing the initiation of the next generation of youth from becoming replacement smokers, it's critical. Now is the time.
Stan Martin, what's next for you?
What's next for me? I'm going to continue to work alongside other champions like Sarah and Pastor Nicholas and our Tobacco Action Group team, my friends over at Roswell Park, and nationally with the African American Tobacco Control Leadership Council and the Center of National Black Health Equity, to really inform our community about the impact of menthol tobacco, and also to reach out to those who can put pen to paper that can really make this come to fruition.
Sarah Pearson-Collins, what's next for you?
I think I'm tackling it from, I guess, a clinical standpoint. I've actually gone back to school and looking to do a lot of research in menthol and how we can effectively approach this with folks who are trying to quit. So, developing content still, and making sure that it is evidence-based, and that we do have something that's concrete when we're trying to treat folks. So.
Yeah. And I would just like just to put a plug in. I mean, if for our listeners, I mean, if you are looking for assistance with quitting, please contact Our New York State Smokers Quit line, 1-866-NY-QUITS, 1-866-NY-QUITS, or 1-866-697-8487. As Sarah mentioned earlier, if you're eligible, which many people are, they have access to nicotine replacement therapy. They have proactive counseling. There are people there who can, assist you along this journey. You don't have to do it alone.
Yep. And then sometimes folks don't want to call. They might want to just go through text messaging because that's like the thing now. So we do have a Learn to Quit New York program. It's a 6-week text messaging program. And that number is 716-309-4688. So, and there's a chat feature. So, there's multiple ways now. It's not just all about a phone call necessarily. It's, just being able to, treatment being at the tip of your fingertips.
Right. And if those who are listening, if you're interested in, working closely with myself in terms of community awareness and education and, joining the fight, feel free to contact me at sm@stanmartinconsulting.com. Once again, sm@stanmartinconsulting.com, or you can reach me at 716-393-2808.
You've been listening to What's Next. I want to thank my guests, Sarah Pearson-Collins from Roswell Park Comprehensive Cancer Center and Stan Martin of Stan Martin Consulting. We'll be back with more What's Next after this.
It's Reading Rainbow's 40th anniversary, and we're celebrating by releasing 40 full episodes of the classic PBS children's series. Look for new episodes every Tuesday and Thursday through February on the Reading Rainbow YouTube channel. Visit readingrainbow.org/watch to find family activities for you and your child to do together after watching episodes. Activities are available in both English and Spanish. The episodes are available on YouTube for a limited time, so subscribe so you don't miss any.
You're listening to What's Next, our place to discuss the important issues of our communities of Western New York and Southern Ontario. We want to hear from you. Click on the Talk to Us option in the WBFO app, and we will work to get your questions or comments on the air. Do you have a story or concern that we should be addressing? Email us using whatsnext@wbfo.org. Together, we'll have the conversations that are needed. This is WBFO, your NPR station.
This is What's Next. We are joined today by Dr. Gary Giovino. He's a SUNY Distinguished Professor Emeritus at the University at Buffalo's Department of Community Health and Health Behavior. Thanks very much for being here with us.
Oh, my pleasure. Thanks for having me.
Dr. Giovino, your field of research and your work is wide, but you're an epidemiologist specifically as it relates to tobacco use. So I'd really like to kind of start there. Much interest in the field of tobacco research, some anti-tobacco advocacy. A lot of that begins with a personal story or often a family story, and I know you have one of those as well. So I'm just curious if you'd be able to share that to kind of start the conversation. We can go from there.
Sure, I'd be glad to. So I'm the son of a man who quit smoking the day the first Surgeon General's report came out in January 1964, and of a woman who didn't. My mother died of lung cancer. She developed lung cancer in 1974 and actually lived almost 5 years, which is a very long time for lung cancer. But that said, I wouldn't wish on anybody what she went through. Many physicians say that lung cancer is the worst way to die. I don't like primacy claims, especially on things like worst way to die, but it was awful. She suffered in so many ways, and I wouldn't wish on anybody what she went through. My dad, when he was explaining to me about the Surgeon General's report, he said, Garrett's the cigarette. The Surgeon General's committee just reported their conclusion that it was cigarette smoking that was the cause of lung cancer and heart disease and some pulmonary diseases. And it led him to stop smoking cigarettes that day. He switched to cigars for a couple of weeks and knew he was kidding himself. And then he just got off everything. So that's the first part of the story. Now, that report came out in January of 1964, and later that summer, so I was probably in 6th, 7th grade, and we would go in the summer days to the local grammar school park playground, and we'd play either baseball or softball. And there were a bunch of kids my age, but there was an older guy, maybe 2-3 years older, who also would often come to play. And this guy had a lot of street cred. He just didn't hit home runs most of the time he came to bat. He would hit home runs on the roof of the school a lot of the time. And so one day I got my courage up. Remember, this is the summer after my father told me about cigarettes, because this man smoked Kool cigarettes. In fact, he had the pack of Kools wrapped up in the sleeve of his white T-shirt. And I said, hey, and I won't say his name, but I said, why do you smoke cigarettes? Don't you know that cigarettes are bad for you? And he said, no, Gare, if you get a cold and you smoke menthol cigarettes, it's actually good for you. And I was kind of getting to the age where, well, maybe my dad didn't know everything, or, other people do know things. And so I just sort of filed that one away in the sort of questionable things that maybe I should look into the future. Well, I have looked into it, and it turns out that menthol cigarettes in the 30s and 40s were advertised as good for you if you got a cold. The Federal Trade Commission in 1942 told the cigarette companies to stop doing that. So they were told to stop doing it in 1942. I'm told they actually didn't enforce it until the early 1950s. Regardless, I asked the question in 1964. For at least a decade, this advertising promoted misinformation was still in the culture, and it influenced this young man so much so that I started smoking daily as a freshman in college. And I would dabble with cigarettes and sort of small cigars with wooden tips when we were in high school, and if we were at parties, and maybe if there was a little alcohol involved. And I thought it made me look cool, and I was big. My dad's once in a while, of course, I had seen him before 1964 smoke these cigars. We would go to the Golden Gloves boxing tournament, and the men there would smoke cigars, believe it or not. And freshman year, when midterms were coming, I was feeling the pressure, and I started purchasing cigarettes. And at first, most of my friends who smoke Marlboros, so I bought a pack of Marlboros, and I remember consciously saying, oh my gosh, those are so harsh. Those have to be bad for you. So then I found Salem and Kool, and both of those seemed, first of all, both of those went down easier, and then I just had to decide which one did I like the taste better. Well, most of your listeners will know that Salem and Kool only came in mentholated varieties, and so the reason they weren't as harsh is that menthol is a topical anesthetic. Menthol adds some cooling phenomena and might mask the harshness of the cigarettes. So because they were easier to inhale, there's actually research that shows that people hold menthol cigarettes in their lungs longer, allowing for more nicotine uptake. There's research that shows that menthol facilitates initiation in young people, just like it did with me. And then there's another component to this, which is not only did I smoke Kools, but I ended up with Kool Milds. Now, Kool Milds is another way of saying, quote unquote, low tar cigarettes. You might know the story of low tar and how they make low tar cigarettes, but just in case, I'll spend a minute or so on that. The cigarette companies figured out a way to use lasers to put little rings of holes in the filters of cigarettes, so that when the federal government's machine that measured tar, nicotine, and carbon monoxide grabbed the filters, I think they went up 3 millimeters on the filters. Well, these rings of holes weren't blocked by the government's machine. And it turns out the more rings of holes they put in, the more oxygen diffused with the smoke, and the lower tar, nicotine, and carbon monoxide levels came out on the government's machine. Now, people don't smoke like the machines. People block the vents with their fingers or their lips. People inhale more deeply. But there's another thing that low-tar cigarettes do, and that is they allow for deeper and easier inhalation. So basically, I was trying to smoke a less dangerous product, although I only realized that in hindsight. I picked menthol, which seemed better, and I picked low tar, which seemed better, and went on my merry way. Subsequent research has shown that menthol cigarettes are at least just as dangerous as cigarettes that are not characterized with menthol flavors. And likewise, low-tar cigarettes are just as dangerous as full-flavored cigarettes. So to the extent that those products facilitate more people to use, and by the way, fewer people to quit, there's more lung cancer. There's actually a different type of lung cancer among low-tar users. And some people would say that the menthol cigarettes also influence the brains of smokers in ways that facilitate the initiation and progression to regular use among young people.
And so that's interesting because you did mention advertising. That was a big part of, the story you just told, because, not only the physiological effects of menthol, but also the way that it is introduced, and a lot of the times that's in advertising. So research has shown that menthol cigarettes have been the subject of targeted advertising efforts directed at communities of color, specifically African American communities. And I think like the biggest question is why? I mean, why has that happened? Why was that able to happen and kind of create patterns that we're sort of the health community is still dealing with?
Right. That's a great question. So first of all, let me say that my colleagues, Mike Cummings, a student intern, and I published the very first one of the first papers, if not the first paper, in the scientific literature, in the public health literature, showing that menthol cigarettes were more likely to be advertised in magazines that targeted African American people compared to non-mentholated cigarettes. About 3/4 of the ads in African American magazines were for mentholated cigarettes, or if the cigarette, like Benson and Hedges, if it came in what they called regular and menthol, in the African American magazine, they put the mentholated brand in front of the quote unquote regular brand, and they said available in menthol and regular. In the white magazines, about 25% of the brands that were advertised were menthol. And in the case of Benson and Hedges, in the magazines that targeted white people, they said available in regular and menthol, and they put the regular cigarette pack in front of the menthol pack. So there's clearly targeted marketing through a major channel back then, which is magazines. The second thing is, and I actually, when I was a graduate student getting a PhD, my PhD project involved teaching physicians at a family medicine center that was on Humboldt Parkway in Buffalo, where most of the patients, most of the clients were African American, not all, but most. So I taught, there were 22 residents. I taught 11 of them, and we had this random assignment to groups, how to help their patients quit smoking. And I taught, actually the teacher there taught the other 11 about sleep and sleep disorders. So we developed a quasi-experimental study. As part of the study, we surveyed the doctors before and after the intervention, and then we surveyed patients before and after seeing doctors. So after I did the interventions, I went in the waiting room, put on the white coat, lab coat, and had my clipboard, and I had about a 12-item questionnaire. And I went up to every person who came in the clinic, and I said, "Oh, excuse me, I'd like to do an interview with cigarette smoking. Would that be okay with you?" And most people said, "Sure." But what blew, I was surprised by two findings. The first was in the data, was when I asked people who smoked what brand they smoked, And the vast majority of African Americans smoke menthol cigarettes. And the vast majority of European Americans, Caucasian Americans in this, in this family medicine center did not smoke mentholated cigarettes. But the second thing that really surprised me was there were several, probably 6 or 7 out of 250 or so, people who were adamant that they looked at me and said, "Oh man, it's okay, it's cool, I smoke menthol." Now, I felt I was a rigorous researcher, and so I wouldn't stop the interview and go, "Oh, why do you say that?" Because that wasn't our protocol. But it turns out subsequently studies have shown that people do believe that menthol cigarettes are less dangerous, in part because they smoke easier. My colleague, Lynn Kozlowski, who's also professor emeritus at University of Buffalo, he calls it the irrefutable testimony of the senses. In other words, if it feels better, it must be better. Well, in the case of menthol cigarettes and light cigarettes are not. So once I was just doing those interviews, it was like, what the heck's going on? And that's when I was motivated one day to look at the magazines. I was actually in the newsroom at Roswell, where they sold newspapers, magazines, and gifts for patients at Roswell Park. That's where I was studying, and that's when I bought magazines that I saw were targeted for African Americans and magazines that I saw were targeted for whites. And then what we did was we expanded the research to a more systematic review of the magazines. But so I found something going on in magazines, but I also I lived on a road that drove up the Kensington Expressway to Michigan Avenue, which Roswell Park is. And one day I was looking up and I saw this huge Alive with Pleasure billboard from Salem, advertising Salem, and it was on Bailey Avenue. And then on the way back, a night or two later, when I was going home after a day's work, I saw Alive as Pleasure. And I thought, wow, this is interesting. So I never published this, but I actually drove around lots of neighborhoods in Western New York. And I actually took my fiance with me at the time. And she's been my wife for 38 years. I didn't lose her over this or anything, but we actually documented billboards in communities that were mostly white, communities that were African American, and did see a pattern of more ads for menthol cigarettes per mile of street in the African American communities. So the first thing you have to think of is marketing to African Americans, and by the way, other people of color, including Hispanics. The second thing, by the way, product characteristics are part of their marketing. If you take the bigger view of marketing, and any cigarette that is easier to smoke is more attractive. But they also did things where they targeted African American communities, and by communities I'll mean or organizations like the Alvin Ailey dance troupe, the ballet group in New York City, and cultural phenomena, and they funded them. And they might have even run ads for menthol cigarettes in booklets that they might have had at their performances. So of course, now we think of advertising and we think of internet and internet influencers, but there were people in those days that they influenced. They might have supported pastors as well. And a lot of these community groups or churches were woefully underfunded. So any help from any organization was by some very much appreciated. In fact, there are a lot of pastors now who are speaking out against the Food and Drug Administration's is considering the policy of banning menthol flavorings in cigarettes and in other tobacco products and in electronic cigarettes and such. So those are some characteristics. By the way, if you look at the ads in African American magazines, they use the image of slimness as just like was used in white magazines for women, that is. But from some focus groups we did, I wasn't sure that that was as influential. So the slimness thing might not have been carrying the day. It was really, if you really go back in time, you'll see some ads from the teens and 20s of the 20th century that commented on how sweet tasting certain tobacco products were. And I think they appealed to taste and that mouthfeel. So that's another possible reason. So yeah, advertising and marketing, what products were they distributing and giving out free samples to in various community settings as well. It all comes into play.
Dr. Gary Giovino, SUNY Distinguished Professor Emeritus at the University at Buffalo's Department of Community Health and Health Behavior, thank you so much for joining us on What's Next.
You're welcome. Thank you for having me.
And this is What's Next on WBFO and WBFO HD1 Buffalo, WOLN Olean, and WUBJ Jamestown, your NPR station.